Douglas Ross.
Thank you, Presiding Officer. On a point of order, can I reiterate the personal apology I gave to you yesterday and extend that to other members and the entire Chamber? By refusing to leave when asked by you on Tuesday night, I accept and acknowledge my behaviour fell well short of what should be expected of MSPs, and I reiterate my sincere apologies to you and the Chamber for my behaviour on Tuesday evening.
Thank you, Mr Ross. We move to general questions. At question number 1, I call Paul O'Kane.
To ask the Scottish Government for what reason it has reportedly reduced the funding it provides to the Mark Scott Leadership for Life programme for 2026-27.
Minister Siobhan Brown.
Thank you, Presiding Officer. Since 2012, the Scottish Government has provided £1.4 million to the Outward Bound Trust to help deliver the Mark Scott Leadership for Life programme. While we recognise the positive impact that the project continues to have, it is one of many that seeks financial support from the Government, and through our Safer Communities funding for 26-27 we plan to provide £3.24 million in direct grant funding to 19 partner organisations. The Outward Bound Trust will receive £30,000 from that fund, and as with previous years, this will help them leverage into support from other funders to enable them to deliver their programme.
Paul O'Kane.
That answer is simply not good enough. The Scottish Government have tried this before. They tried to cut funding for this vital work a few years ago, but were forced into a U-turn by cross-party opposition. Indeed, I pay tribute to the former First Minister, Hamza Yousaf, who personally intervened to ensure that the funding would be reinstated. Yet we're back to where we started. This award commemorates the life of a man who was murdered in senseless sectarian violence. It provides opportunities to hundreds of young people every year from Scotland's most deprived communities to learn and to come together. Niall and Judith, Mark's parents, have written to the Minister, have written to the First Minister, but have received no response. I think that is outrageous. When will they receive a response? And does she not agree that cutting investment in preventative youth work for the sake of saving £45,000 is short-sighted? And will she look again at this decision?
Minister.
Thank you. First of all, apologies. I'm not aware of any correspondence coming in. I have not seen that yet, although I will chase that up today. There have been funding pressures across the Scottish Government, and it has meant that difficult decisions have been made and priorities identified. We continue to support the Mark Scott Leadership for Life Award and look forward to continuing to work with the Outward Bound Trust. But the Scottish Government has to align funding more closely to the vision of justice, and that means reprioritising the initiatives that can be supported. But I do need to highlight that the Scottish Government grant also provides part of the funding required to run the award, and they do a magnificent job in raising the required funding to run the award each year. We are in discussions with them to understand the impact, but hope that funding can continue to be raised from other sources.
Annabel Ewing.
Thank you, Presiding Officer. I would wish to add my total dismay to the situation that we find ourselves in, and I share the anger of Paul O'Kane on the matter. This is indeed a very short-sighted approach by the Government, I would have to say. This is a unique project. It has been hugely beneficial to all the young people who have taken part over the years from all backgrounds. It has a proven track record of success, and it has ensured that young people can take the better path, which I would have thought is what the Justice team is hoping for in terms of future generations. So surely, Minister, some small additional funding could be found to ensure that this excellent project can continue.
Always through the Chair. Minister.
Thank you. Yes, we're all aware of the great work that has been done by the Mark Scott Leadership for Life Award, and as I said to Mr O'Kane, we will continue to work with the organisation to see if there is funding that could be found from other portfolios to support this. But we will continue to give them £30,000 in this financial year, which will open up levers for further funding avenues for them.
Question number 2, Mark Griffin.
Thank you, Presiding Officer. To ask the Scottish Government what funding it provides to support research into finding a cure for motor neuron disease.
Minister Jenny Minto.
Thank you, Presiding Officer. Within the Scottish Government, the Chief Scientist Office supports health and care research through both direct funding and infrastructure support. The Chief Scientist Office is currently funding 2 fellowships in motor neuron disease, with a total funding commitment of £485,000. Further applications on motor neuron disease to the Chief Scientist Office's project and fellowship funding schemes are welcomed. The Scottish Government provides annual funding of £665,000 to the NHS Research Scotland Neuroprogressive Disease Network to support the delivery of clinical trials in Scotland for neurodegenerative conditions, including motor neuron disease.
Mark Griffin.
I met with my constituent Mark Somerville and other brave MND sufferers 2 weeks ago. They were protesting outside in the cold and rain because, despite writing to the First Minister on multiple occasions, they've had no response from anyone in government. Mark has a young family and is desperate to see investment in a cure or treatments that could slow down the progression of MND. He feels, and so did other people in the cold and rain that day, that by failing to meet with them, ministers fail to understand the urgency of their situation. So can the Minister say why Mark and others with MND feel ignored by this government?
Minister.
I thank Mark Griffin for his supplementary question and recognise the importance of conditions like motor neuron disease. We are firmly committed, the Scottish Government is firmly committed to increasing access to new and innovative medicines, and I absolutely recognise the key importance of medical and scientific research needs funding towards finding a cure for MND. That's why over 350 patients from Scotland have been recruited to the UK-wide MND Smart clinical trial, but I recognise the important work that Mark Somerville is doing to ensure that more work is done in that area, and I thank Mr Griffin for bringing that to this chamber, and I will chase up any response to letters as well.
Question number 3, Jamie Green.
Thank you. To ask the Scottish Government what discussions it has had with the Crown Office and Procurator Fiscal Service and other relevant criminal justice organisations regarding the implementation of Section 34 of the Victims, Witnesses and Justice Reform Scotland Act 2025.
Secretary Angela Constance.
Presiding Officer, the Scottish Government is engaging with justice bodies and stakeholders across the sector on implementation of the Victims, Witness and Justice Reform Scotland Act 2025 following royal assent, including Section 34. This includes discussions with officials from the Crown Office and Procurator Fiscal Service. Implementation of the Act is being phased to ensure operational implications and readiness are duly considered across the system, and we will continue discussions with the Crown Office and Procurator Fiscal Service and other justice bodies and stakeholders in this regard.
Jamie Green.
Can I thank the Cabinet Secretary? Just for the benefit of the public, this section gives all victims the right to be informed of any decision not to prosecute or to discontinue prosecution proceedings. It strengthens the rights of victims in Scotland, and I know the Government did not support it, but it passed in this Parliament and it is in the bill whether the Government likes it or not. Other parts of this bill were implemented swiftly, such as the removal of the not proven verdict. So when it suits the Government, they can introduce parts of this bill swiftly and act on the implementation of this legislation. I would like to ask the Cabinet Secretary directly, though, has she instructed the COPFS to implement this change in the law? And if so, when will we see it implemented in full?
Cabinet Secretary.
Presiding Officer, I know that Mr Green will appreciate the size and scale of the Victims, Witness and Justice Reform legislation. He quite rightly narrates that the first action, the first implementation was the abolition of the not proven. There are further measures that are either being enacted or are in train, and I know that Mr Green has a particular interest in Section 55 and 56 that have required the parole board to consider whether a prisoner has revealed information on a victim's remains and other measures around the safety of victims. In terms of specifically, Mr Green will recall that I noted with regards to Section 34 that the particular popular amendment moved by Mr Green during the Stage 3 debate, and yes, it was indeed passed. That was the will of Parliament. I did state that these provisions are operationally complex and that careful consideration is required, and we will, I can assure the member, keep implementation of the provision under review while we continue our discussions with the Crown Office. It's important that we consider the operational implications and readiness.
Question number 4, John Mason.
Thank you. To ask the Scottish Government how it ensures that the Good Food Nation Scotland Act 2022 aligns with fair trade principles for imported food and drink.
Cabinet Secretary Mary Goujon.
While the Good Food Nation Scotland Act 2022 doesn't reference imported food and drink, some of the principles that are set out in the Act are relevant to the fair trade principles. Additionally, our strategic approach to trade policy is set out in Scotland's Vision for Trade, which is a values-based approach. And our annual report, published in January this year, sets out recent progress in putting these values into practice.
John Mason.
I thank Cabinet Secretary for that reply. Outcome 6B of the Good Food Nation plan refers to positive contribution to global food system transformation, but there are no indicators. Now, I would have thought that that would have an impact on fair trade, and could there not be fair trade used as part of the indicators?
Cabinet Secretary.
I appreciate the concern that has been raised by John Mason, but what I would say in relation to the indicators that we've set out in the Good Food Nation plan is that when we were looking at the criteria for what indicators should be included, we were really looking for indicators where there was information that was readily available, understandable and accessible for a use by a wide range of stakeholders, that was also sensitive enough to detect changes over time, cost-effective to use, and it would have low resource requirements. And what I would want to emphasise is that while we don't have a current indicator in relation to that, this is the first plan. We can only look to build on it, to fill the data gaps where they exist, and to look to find that data and evidence so that we have suitable indicators there for the future. Because I do think it's an important point. We need to have indicators and a monitoring framework if we want to make sure we're making good progress on our Good Food Nation ambitions.
Question number 5, Rona Mackay.
Thank you, Presiding Officer. To ask the Scottish Government what progress it's made towards the establishment of a pathway for free dyslexia assessments at the point of contact for adults.
Minister Tom Arthur.
As part of building a fairer, more inclusive Scotland, the Scottish Government is committed to ensuring that all children, young people and adults with dyslexia receive the support they need to reach their full potential. There are clear duties on education authorities to identify, provide for and review the additional support needs of school pupils. In relation to adults and employment, our Fair Work approach ensures disabled people, including those with dyslexia, get the support they need at work without an adult assessment, including through Access to Work and Working Health Services Scotland.
Rona Mackay.
I thank the Minister for that answer. Around 1 in 10 people in Scotland are dyslexic, and without meaningful reform, too many people will be disadvantaged in a perpetual cycle. Adult assessments, early intervention, along with teacher training and school support are key asks of the Dyslexia Manifesto. Can the Minister confirm that the Scottish Government will commit to addressing these issues in the next Parliament?
Minister.
Can I thank Rona Mackay for her supplementary and state that the Scottish Government is committed to ensuring that all children, young people and adults with dyslexia receive appropriate support to reach their full potential. The Cabinet Secretary for Education and Skills asked Janie McManus to conduct a short, sharp review of additional support needs in schools. This will report before the end of the parliamentary term. Local authorities spend over £1.1 billion on additional support for learning in 2024-25, and additional funding was provided in 25-26 to support the ASN workforce and teacher numbers, which will be sustained in 26-27 following the passing of the Scottish Government's budget. I recently met jointly with the Cabinet Secretary for Education and Skills to discuss these issues with Dyslexia Scotland, and will have further engagement.
Question number 6, Kenneth Gibson.
Thank you, Presiding Officer. To ask the Scottish Government what criteria are applied in deciding on the location of the new walk-in GP clinics.
Cabinet Secretary Neil Gray.
Presiding Officer, we were pleased to announce, as part of the First Minister's visit to Shetland this week, 16 planned centres with 12 new sites from Stranraer to Shetland, confirmed, building on opening the first walk-in centre in Edinburgh in February. Criteria used to assess Health Board proposals were readiness, workforce feasibility, benefit to patients, estate suitability, integration and coherence, governance, evaluation capacity, funding estimate and commitment to collaboration. With centres open from 12 till 8 p.m, 7 days a week and based on accessible locations nationwide, this is part of a package of measures addressing the 8 a.m. rush that has frustrated so many of us and will ease GP capacity pressures.
Ms Gibson.
I thank the Cabinet Secretary for that response. The three towns of Ardrossan, Saltcoats and Stevenston constitute the second largest conurbation in Scotland not to have a hospital and include sizeable levels of deprivation. North Ayrshire had high levels of drug and alcohol misuse, and people lose good health far earlier than the Scottish average. Can the Health Secretary therefore please advise as to how soon we can expect to see a walk-in clinic in the three towns, and will he meet with me to discuss this further?
Cabinet Secretary.
Thank you, President Officer. I very much recognise the issues that Mr Gibson is raising about his constituency demographic profile and the services within it. I can also understand why that could benefit from a walk-in GP service. I'd be more than happy to discuss this with him further in a meeting if you'd contact my office to arrange.
Sandish Gulhani.
Declaration of interest as a practising NHS GP. The First Minister's announcement of GP walk-in centres at SNP conference was simply an election stunt. The First Minister announced it without consultation with stakeholders and probably shocked his own civil servants. The First Minister's spin doctors clearly loved the title, and now the SNP are scrabbling around to backfill the details. Even the Cabinet Secretary for Health was unable to answer my previous questions with any detail at all because there were none. So can I ask the Cabinet Secretary, will patients exclusively see GPs when they attend a GP walk-in centre? And if not, what percentage of appointments will they actually see a GP? Or has this not been discussed with the SNP campaign team yet?
Cabinet Secretary.
Presiding Officer, the walk-in services will provide appointments for GPs and also other practice staff, and are popular with the public because they are designed alongside the record investment that we're putting forward into core general practice over the next 3 years that I noticed Mr Gulhani and his colleagues voted against in the budget this week, which is for shame that they refused not just to support it but actually actively voted against the record funding investment into core general practice services. We are broadening the front door of our NHS through that record investment. We're making it more flexible through walk-in GP services, and we will continue in that regard and ensure that our NHS is fit for the future.
Question number 7, Colette Stevenson.
Thank you, Presiding Officer. To ask the Scottish Government what steps are being taken to reduce orthopedic services waiting times across NHS Lanarkshire.
Cabinet Secretary.
Presiding Officer, we're making undeniable progress in clearing waits of over a year with consistent month-on-month improvement. We know there is still more to do, but our plan is working. Indeed, we have now seen 8 months in a row of reduced waiting lists, and that has been driven by increased appointments and the incredible efforts of our staff. This year, we have allocated more than £135 million of additional funding to health boards to help tackle the longest waits, including in NHS Lanarkshire, to target orthopedic waiting times, and this includes recruitment to expand their consultant workforce. NHS Lanarkshire continues to receive additional orthopedic capacity at the Golden Jubilee National Hospital to prioritise long-waiting patients, and from April will also have capacity at NHS Forth Valley.
Colette Stevenson.
I thank the Cabinet Secretary for that response. And workforce statistics show that since the SNP entered government, there are thousands more doctors and nurses in Scotland hospitals. We've avoided NHS strikes here as well, unlike other parts of the UK. However, I have been contacted by constituents who are concerned about the waiting times for orthopedic procedures. Can the Cabinet Secretary confirm how the 2026-27 budget, approved by Parliament yesterday, will support NHS reforms and help NHS Lanarkshire to further tackle the waiting lists and deliver more appointments?
Cabinet Secretary.
Presiding Officer, Colette Stevenson is absolutely right. We have increased the workforce across the NHS under this government. We have also been the only part of the United Kingdom to avoid NHS strikes, which is because we have taken an approach with our trade union colleagues which is collaborative and based on compromise, unlike other parts of the UK. The budget investment that we're taking forward in the coming year includes a record investment in our health service of £22.5 billion and continued targeted investment into reducing long waits, so that the progress we have made this year can be continued without any interruption over the coming year, so that we can see patients much faster and see those waiting times continue to reduce.
Thank you. Miles Briggs.
Thank you, Presiding Officer. To ask the Scottish Government, in light of the recent announcement that the freeze on council housing allocation in Edinburgh will continue until March 2027, what support is it providing to the City of Edinburgh Council to address the housing crisis?
Cabinet Secretary Mary McCallum.
The Scottish Government is working closely with Edinburgh Council as one of the local authorities facing the most significant housing and homelessness pressures. Edinburgh's allocation of £28.7 million from our £80 million acquisitions fund brings their total capital funding to over £73 million this year, supporting them to acquire properties immediately for affordable housing. I welcome the Council's actions to meet its statutory duties, including directing stock to homeless households, and I believe that this, among many other approaches that we're working with them on, will help to reduce temporary accommodation pressures.
Miles Briggs.
I thank the Cabinet Secretary for that answer, but yesterday's budget once again resulted in Edinburgh seeing the lowest funding per head of population from Scottish ministers, at the same time that the local authority also sees the lowest number of social housing stock with a rapidly growing population. With the waiting list for social housing in the capital now being completely unsustainable, can I ask the Cabinet Secretary whether or not the Government will now commit to an Edinburgh-specific housing fund to help address the housing emergency?
Cabinet Secretary.
Officer, as I've said, we're working very closely with Edinburgh City, amongst other councils, to help them tackle the multifaceted issue of homelessness and temporary accommodation pressures. But Miles Briggs talks of the budget. Yesterday's budget, which I'm delighted has passed, included £926 million in the Affordable Home Supply Programme, which is the largest single allocation for affordable homes on record. I only wish Miles Briggs could have brought himself to vote for it.
Thank you.